Okay, so go ahead.
Okay, let's start, guys. First, we'll go what is a medical coding. So, in simple term, medical coding is a process of transforming your medical records into the alphanumerical code. Okay, what it means we have one record. Doctor is giving everything what patient came with, patient complaints, what is going through. Doctor checks is everything, means its system, nose, hand, everything. So, what medical coder does? What exactly in the reports? He find out what exactly. Just a second.
Saki, you carry on with PPT. I will admit if anyone joins.
Yeah, fine. Thank you. So, next thing, what is the importance of medical coding? So, mostly it is used as a crucial for healthcare billing, ensures claim processing, and maintaining the patient records. So, what exactly it means? When the coder does the coding, it goes for a payment. So, does that billing people know everything about this coding, what we are doing? So, they don't know. So, what they know? They know that the alphanumerical code. What does means CPT? Means what service was performed. Means whatever the physician gave, physician asked us to do anything, means do the X-ray, do the MRI. That's called a service, means that's called a CPT. And what the ICD means, what that service was needed. Means for what reason physician asked you to do that procedure, that means that ICD. So billing people does know only the code. Okay, so I'll give you just rough example. So in coding system, what are the code means? So these are basically categorized into ICD-10, CPT, and modifiers. So what is ICD-10 CM means? It is the International Classification of Disease. So what it means when we go for a fever, headache, that means what? We tell it as I had a fever last night, I am having cough last night, or I'm suffering from this disease. So what the coder do? Coder read that report and he identified the patient has a fever diagnosis. But that R59 is the diagnosis for the fever. But it's not from the coder end. It is a international classification disease, that is ICD-10. It is a standard diagnosis which we will coder identify from the ICD-10 book. Next, what is a CPT? CPT is the current procedural terminology that is used for procedure and service coding. As I already told you, when physician asks you to go for an X-ray, go for an MRI, that procedure, or physician asks you for we have to do some surgery. So that procedure is called a CPT. For example, if physician asks us for X-ray chest, so what is the CPT for that is 71046. By identifying this, should I wait for some time? Kiran, Manideep, should I wait?
Yeah. Just hold on because still people are joining.
Yeah.
Yeah,
Just
yes,
hold on.
Binali. Actually, few more
Okay.
people joined just now. Just
So just tell me when to start. I'll wait in this slide only. So I'll brief again for ICD and CPD things.
Yes. And also I shared one RCM cycle picture. Could you please check in Teams text box?
Chat box. Okay.
Please go ahead on this. Like actually medical
You
coding
can start.
of
I'll continue in that. Yeah.
yeah, sure. So I want to add 2 points in this. Sorry for the disturbance. Hello guys. So mainly medical coding role is we are working for physician and insurance in between. Okay, so what is the main purpose of medical coding is we are translating the physician documentations. Like if physician is providing any lab exam or any kind of service, so that codes we are converting into alphanumeric codes. Why? Because insurance won't like read handwriting records, right? So to understand the insurance for a payable purpose, we are translating the medical record into alphanumeric codes. So this is the cycle of complete medical coding and RCM. It will work. So initially, the patient will verify and registrations. Like whenever patient is went to the hospital and he will take an OP administration, right? So for that they will analyze and patient having any like insurance or having any other kind of like insurance or government insurance or private insurance they will check. Later, uh, patient will send to the consultation. So later, after consultation completion, then medical coding scope will start here. The third point, right side. So medical coding estimation and pre-authorization. So here our, I'm sorry.
No. So not for
Okay.
you. You can
So
continue.
he, yes. So here our scope will start like a medical coder is required in this case. So if provider is completing his scope and he providing medical record, medical coder will review the documentation and he will translate the medical procedures or disease condition. Disease means illness conditions to the numeric codes. Okay, after completing this chart, again we have a lot of claims like a billing and a charge review. Okay, the final is payment to the provider. Who will give the payment? Insurance will provide the payment. So entire it's a cycle between physician, patient, and payer. Payer in the sense insurance company. So basically we are working for physician documentations. I think you guys got a little bit of idea on this.
Yeah. Should we
Yeah, go
continue
ahead.
with our
Yeah,
presentation?
go
Yeah.
ahead. Sorry.
No issue, no issue. So whatever he told is that whatever coding is doing for coding purpose, the chart is divided into your diagnosis, that is ICD-10, your procedure, that is CPT, and next we move to modifier. What is the modifier? It is the additional codes that provide you extra information about the procedure. So what happens if you go for any extremity pain, like you have a hand pain, you have a leg pain? So in that case, if you guys also observe in your X-ray report, physician mentioned that you need to do for a right side hand, left hand, right leg, left pain. So that is called the laterality modifier. So this modifier also helps you in the coding. Fine. Next, what is it? Who can apply this? So who can apply for the medical coding jobs? The people, graduates, postgraduate in life sciences, paramedicals, biotechnology, microbiology, nursing, pharmacist, D Pharm, M Pharm, physiotherapist, BHMS, BMS. All of them can apply for a medical coding job. Next, we have why. Why only these people are can apply this job? Because as you guys know, these people know the human anatomy well. So as our coding is completely depend on human body. So that's why these people only can apply for this medical coding job. If you are a pharmacist and you don't want to go on pharmacy, then you can move into medical coding job. So it is an easy way of transition. Oh, I hope you guys are getting me, or am I going so fast? If you have any doubts, you can just stop me and tell me. Anything is need to clear.
Can anyone please confirm whether this is understandable or we are going a little bit faster?
Understanding, sir.
Thank you.
Thank you so much. So, for joining in the medical coding, we have some certification, that is CPC, CCS, CRC, and CIC. CureKode is right now focusing on CPC, which is mentioned directly certified professional coder. So when you are having this CPC certification, you will get a direct entry to the medical coding, because these healthcare industries, we are looking for the hospitals of US and all. So what they are, our client are checking how many CPC certified coders are there. So that's why this certification is very much important. And we are in that CPC certification training. Next, what is the CPC certification training? What exactly we are doing in that? So this is a 3 months of duration. So in that, we will go through everything. What is the CPC? Means ICD part, CPT part, HCPCS, and not just this, only the CPT, ICD, what it is. We'll brush up everything of your human anatomy knowledge, your physiology, everything we are telling you, each and everything in details. Okay, so you will not do that how I will understand this. And in CPT, what is CPT? You just know that is the CPT. But that CPT, no one can remember, no? For X-ray, what is the CPT? So what we will teach you, how to navigate through that CPT book. What is the ICD? So how to navigate through that ICD-10 book. Next is, see, whatever I told you now, what we are covering in this CPC course, that is mentioned over here. I just brief you again. ICD-10. For ICD-10, we have just a second.
Hello.
Yeah, Rian
This
has. Okay. So should I continue? So in that CPC book, what we are covering, that is ICD-10, means how to lead into ICD-10. Deep, can you just admit the people? Next, what is the CPT? And this CPT ranges is from 1000 to 9000 series. So no one can remember. So we will navigate you how to look at the CPT book from that record, how to find out what exactly which CPT you have to code. Everything will be teach by us. Modifiers thing, as I told you, we'll start with anatomy and physiology. We will have your mock test so that you can understand what the kind of question is asking for CPC exam. Will prepare you for everything. Next, we have work from office as well as work from home option in medical coding job. So which is the best for us? Mostly for females to do work from home. Second. Okay. mostly our shift timing are general shifts only, means 8 to 5, 9 to 6 only. So this is the main advantage of your medical coding journey. Then how you will grow in your career? First, after clearing your CPC examination, CPC certification, you will join in any company as a junior coder. Then you can move as a senior coder. You can become a quality analyst, that is auditor. Next, what we can have, you can become a trainer, team lead, manager, and so on. Next, we have medical coding salary ranges. So this salary ranges as a fresher means after you become a certified CPC. So that ranges is from 18K to 28K in first year. And it is goes like this: 3 to 4 lakh per annum, 5 to 7 lakh per annum, 10 to 18 lakhs per annum. So now we are gone through what is CPT, what is ICD. Then why? Everything is done. But why medical coding? Because now medical coding is too much high in demand. So that's why you can select this as a your career. You have work from home option, which is flexible timing. You can maintain in office, stable career you have, and you have so many growth opportunity. Now we'll continue with why CureKodes, that will explain by Satyajit.
Hi, everyone. Thank you so much for joining the online webinar that is for the medical coding career and what is CPC certification about. I hope everything was delivered to you. Well, just in short, why do medical coding? Well, in past, when we used to do any kind of graduation, we only had certain options. But now, as technology is growing, and we have the ability to grow with the technology. What I mean by technology, like the medical coding part. Medical coding part came into picture because insurance came into part. And all this circle meant something, created a new job profile. And those are multiple job profiles, which is medical coder. You could be a denial coder. You could go into insurance, you could go into billing and many more options. So when someone, let's say a B Farm used to graduate, he had certain job openings only, that is into a pharmaceutical company or any particular biolab or something like that. But now there are various opportunities and medical coding is one of them. And it's not just booming in America, it is going to boom in India as well. Same as the payment gateway, as we had Phone Pay, the digital payment, we have Google Pay, we have Paytm. The same way, even government of India can implement medical coding in India as well. So this is one of the best futures. This is one of the best opportunities right now to grab and make a career out of it. And then why CureKodes? Well, we just not teach you, that is the certification part. We make you in believe that how could you grow in the medical domain industry. It's not just an institute wherein you would learn the certification part and they will help you to pass and that's it. No, we are not like them. We will help you to grow, make sure that whatever you are going to learn, it is digested by you. it is understood by you and you can implement it, you can pass the interview and get the job. So yes, medical coding is the now and future. And today we are also having excuse me. And today we are having a small slot opening. That is, you could book a slot today itself, book your seat. That is just with 500 rupees as well. And we are starting a new batch soon. So you could join that batch and start your great career. Over to you, Kranti. I'll stop sharing the screen.
Yes, Satyajit. Hi, everyone. Did everyone understood what is medical coding, or anyone require additional information? No. Yes, please.
Understood, sir.
Okay. Just 1 minute. I'm just sharing my screen. Bad here. Satyajit, is it my screen is visible now?
Yes, Kiran, your screen is visible.
So whatever Saki was given information, it's exactly correct. But I want to add 2 points here. So generally, the medical coding role is transforming the medical codes into numeric alphanumeric codes. So what is a numeric alphanumeric codes? In the sense, medical records we are transferring into alphanumeric 5 digits of numbers. So who provided that alphanumeric
Kranti,
codes
your
and
voice
what
is not audible.
uh, now? Hello?
Yes,
Yes, we
Kiran,
can
you're
hear
audible.
you very clearly.
Okay, thanks, Mithali. Mithila, sorry. Okay. See here, the medical coding role is converting medical records into numeric alphanumeric codes. So what is numeric alphanumeric codes and who is provided that numberings? So there is a AMA and CMS, two two departments, two organizations in US. That is AMA standards for American Medical Association. CMS is for Center for Medicare and Medicaid Services. So these two organizations are provided as CPT and ICT books. Okay, why they are provided the books? Because we no need to code personally, or we no need to think about the CPT where we have to code. Actually, they provided some books, CPT, HCD, and HPCS codes. In that book only, we have to verify the procedure and diagnosis and what are the required modifiers. So based on the documentation only, we should code. So all these required material, they are given in the under these 3 books like CPT, ICD, and modifiers. So here I added additional points like insurance companies pay providers based on these codes. Like see here, insurance companies only process the claims in code format. So that's why this medical coding is started this career, started this format insurance. They want to pay the amount. Insurance required the codes like a code purpose, code type of they will give revenue. So each code having separate revenue numbers. For example, surgery CPT is having $1,000, like radiology diagnostics having $2,000. Okay. The main purpose is translating the medical records into numeric and alphanumeric. So we are not going anything about the beyond the book. Okay, so we have to verify and we have to navigate the books. Then only we can assign the correct codes like ICD and CPT. So that's all my side. Thank you so much. Because see here, I mentioned clear points like insurance company do not read handwritten notes. Codes can help fast electronic communication between hospital and insurance payers and government systems and billing software. I think you guys get a clear idea on this. Still, if you guys have any doubt, please let me know what is medical coding. I will explain on this.
Uh, Hello, good afternoon. This is Abdeep here.
Yeah.
I joined a little late
Yeah.
as I am working from home. So I
Okay.
just want to know, can you can you get back and what is exactly medical coding in brief term? Just want to understand more.
Sure, sure. Actually, I'll tell you what is medical coding role is doing in this. Okay, the
Mm-hmm.
medical coding in the sense we are working for a physician and insurance purpose. So I'll give you one example. Wait,
Okay.
I'm sharing my screen 1 minute.
Yeah.
Is it up my screen?
Yes, your screen is visible.
Yes. So previously I said that in medical coding, there is a two organizations like AMA, American Medical Association, CMS, Center for Medicare and Medicaid organization. These two organizations provided CPT book and ICD. ICD in the sense International Classification Diseases. Okay, and HPCS. So
Okay.
what is CPT? What is ICD? What is HPCS in the sense? Uh, For example, physician ordered X-ray. We know, right? X-ray and CT scans.
Mm-hmm.
So physician ordered one X-ray for chest, and the
Okay.
diagnosis in the sense like a illness or a disease condition. So patient came with pain, chest pain. Okay. So later, physician found that nothing is find out. So he mentioned this take rest and drink plenty of water, physician was advised. Okay. So
Mm-hmm.
this chart need to be built to physician. So what physician will do directly, if patient having any insurance, for example, patient having Medicare. Initially, I shown you this page, like initial register only. Whenever patient coming to the hospital, the front desk people, they will verify patient having any insurance company, insurance policies or not. So if patient having insurance policy, so this chart should be go to insurance company. So insurance will pay to the physician.
Okay.
Okay, insurance should be paid to physician.
Okay.
So directly they won't read medical records, insurance people. So what they will do, they will include medical coder in this. So medical coder actually what he do, he will review entire chart, whatever a physician provided, like a chest X-ray, pain, and this. So he will assign like a, I said like here CPT and ICT is there, right? So procedure in the sense CPT. So medical coder will assign for X-ray chest having separate code. So he will give 71045 for examination, and for pain, we have a separate code for pain, chest pain in ICD book. So he will assign while leading in the book. So he will assign like R70.9, and he will rebuild. He will code this chart based on the provided physician provided document, and he will rebuild to the billing team. Okay. So
Okay.
later billing completion, insurance will pay the amount to the physician because they want this chart format in the code range. I think you understood this point.
Yep.
Still you have a doubt? It's
No,
simple.
no.
Like we are translating medical records into alphanumeric codes. Why we are
Alphanumeric values.
yes. Why we are changing these alphanumeric codes means there is a AMA and CMS. They are provided some like a laws. Like this should be built with numeric codes only. Okay, and insurance also they won't allow and they won't have a chance to review medical records. So that's why they are implemented this code range, code type of format. So nothing we have to find beyond the book. Whatever they are documenting, they are already they are included in these three books. So based on the chart and based on the documentation examination, we have to verify the CPT and ICD. Then we have to resubmit. Then next parts, billing people will work on that. Then finally, this amount will receive to payer, provider in the sense physician. So our medical
Okay.
code role is it will come here like third step. After consultation, like a physician people, they will provide us charts like clients, third party vendors. So here medical coder is he will review the documentation and he will assign the based on the books like CPT and ICD.
Okay. So
Understood?
nothing will come beyond the book, right? Beyond
No,
these three
no,
books.
we should not
Okay.
give any code beyond the book.
Okay.
Nothing we have to set outside also. Whatever the documented, we should verify from the book only.
Okay.
Yeah. They given
Okay.
set
Thank
of
you.
codes for each and everything. And also I will add one more point here. Sorry, I was missed. CPT book. CPT book every year they will update codes. Like if they want to add any procedure codes or deletion codes, they will update every year on Jan 1st.
Every year is
Every
Jan
Jan
1st.
1st. Yes. So this 2026 updated already came, and this from January 1st onwards, additionally, they are adding 283 new codes and they deleted 80 codes and revised 43 codes.
So means
Okay.
these codes are getting reviewed also, right? Every
Yes,
year.
yes, yes,
Okay.
exactly. They will review and they will add if they want to add any specific procedures.
Okay.
Okay.
And they will
So
delete
ICD,
also, right?
yeah, they will delete also. Correct. And ICD also same. Every year they will update October 1st.
Okay.
Yeah.
So from study point of view, we have to go through all three books, like
Yes,
reading or
yes.
okay.
CPT and ICD, these two, I mean, yes, these two only are very important to clear the CPC.
Okay. And how is the examination? Is it like multiple choice or how it is?
Yeah, multiple choice
Okay.
only.
And how many sets of questions are there in exam?
Uh, Actually, 100 questions they will give. Out of
Okay.
100, we can get at least 70. 70 is pass mark. So
Okay. Okay.
yeah, correct.
And
So
one more
below
point I
below
have to add is
yeah,
we have two attempts for this granting. Yes, you
yeah,
explain that point also.
yeah, please.
Hmm.
Sorry, sir. Somebody was saying something, right? About the examination points. Sorry, the attempts.
Yes,
Two
yes,
attempts, right?
Abhijit. Yes,
Okay.
Abhijit.
Okay.
First, after completing medical coding training, we have to write an exam to clear the CPC exam. So they will providing two attempts for us. So if first attempt is not clearing, then second attempt we can clear. They are giving two options, two choices to clear that exam. 100 marks question paper. In that, we should get 70 marks.
Okay. Okay.
Yeah.
So 70 is a passing score.
Yes, 70 is passing.
Okay. Okay.
And,
Okay. Thank
it
you.
is
Thank
in
you for
open book, so easy.
Easy to clear CPC exams. No worries because we have a we have a many years of experience trainers. So it's good to start in QR codes. And also in QR codes, we are not only giving like a medical coding training itself, like a CPC like that. So additionally, the certification, if you want to see check whether certification can be earned from any institute. in a short time or long time, and they are providing 30, 90 days or 30 days also. But only certification is not enough to get medical coding job. Additionally, skill set is everything in QR codes. Sorry, to get the job. So in QR codes, we are stand by our promise. Like every student will be trained with the complete conceptual knowledge plus strong practical coding skills. So we are focusing on real-time practice, charge codes, and job-oriented training. So our students become industry and ready to content the coders. So we are strict on our words. So please go ahead if you anyone having any doubts on this.
Hello, I have a doubt.
Yeah, hi.
Yeah, this is Dr. Mithila.
Yeah.
Which is the institute you're providing the certificate of? Like you're affiliated with which institute that you're providing the certificate?
No, actually, I want to add one more point here. Certifications we are not providing. Okay,
Hello.
certification like as I said,
Hello.
CMAs and AMA is there, right? There is a another wait, I'm sharing my screen
Hello.
again. Yeah, I'm sharing my screen. 1 minute, please. Is it up my screen? So
I
there is,
missed the conversation in between. Will you please repeat whatever you said?
yeah. Is it up my screen?
Yeah.
So here, we are not. No institute can provide CPC certification. Okay, AAPC only it will provide certification and it will give like it will provide some scheduled examinations. Like January month, they will give some schedule of date. So on that date only we have to attempt the exam. So it's AAPC is organized by American government only. So we are not giving any certification to you. You have to prepare what is medical coding, what are the CPT and what is CPT questions, what kind of CPT questions it will come under examination. So later you should write the exam in like AAPC, whichever connected by the AAPC. In that exam, you have whenever you are passing the AAPC exam, CPC exam, then they will provide you logins and they will give you one credential numbers. So it's completely
Okay.
from the
So
US story. Yeah,
AAPC will be conducting the exam and they will be
correct,
giving the certificate, right?
correct.
But what will the fees to appear for the examination afterwards?
It's yeah. Right now it's completely depend on the dollar values. So right now the CPC exam amount is 76,000, I think. Yes. Sometimes it will increase and sometimes it will be low.
So you
It's
will be
completely
just giving us the training
training.
to pass the, I mean, whatever the books are there. So you will be teaching us those books, and the
Correct.
examination fees will be different.
Yeah, yes. Yes, Mithila. Exactly. We are
Correct.
just providing the knowledge on CPT and ICD and what is medical coding. Later, that exam fees is different.
The exam fee it
Yes,
goes
along with
to
that, we'll
AAPC.
provide job assistance also. Yeah, carry on, actually.
Yes, yes. The exam fee goes to AAPC, that is American Association of Professional Coders. Just like you may, or every one of us have heard of ISO, right? There are ISO certifications on products. So this certification is by the American government, that is American Association of Professional Coders, and all the fee goes to AAPC. Just like when we give exam for our graduation, uh, some fee goes
Okay,
to
understood. I
college.
got it.
Yeah, yeah.
Yeah, everybody got it, I guess. Because so now you're charging 500 for this training, and then we will have to fill up the exam fee afterwards when we finish this course,
No, 500 fees just to book the class.
book the class. And what are the
Yeah,
class course? I mean, what is the fees
it
for
is
the
16,000
16,000? So
for three
yeah,
months.
you didn't mention that, so I asked.
Oh,
So around 1 lakh rupees we have to spend to get the certification.
correct.
Okay. And afterwards, you will be helping us to get the job.
Correct.
A job where?
A job in like remote, we have multiple companies that is in Hyderabad, Chennai, Bangalore, even in North. So yes, there are multiple companies we could apply for,
Mm.
and we will help you with that to get a job.
Sorry to interrupt. May I know where you're from, Mithila?
Nashik.
Nasik, okay. We have a yes, correct. In Nasik also we have a many multiple medical coding companies and nearby Pune also, like AGS and SS Healthcare. So no issue. We'll refer in that companies if you are interested. And also, I want to add one more point. 16,000 right now we are charging for CPC training for 3 months, but it's not a fixed amount. For this batch, we are reduced the amount, and it's a discount policy. So that's why we are giving under 16,000. So previously, actually, as per market standards, the CPC training amount is 25,000
Okay.
generally. If you want to check with any other student
No,
institutes,
no, I just because I thought you are giving this training in 500 rupees, so I got surprised, so
no,
I asked.
no, Mithila. Actually,
Yeah.
500 is for registration purpose only we kept.
Okay, okay. Yeah. Thank you.
Yeah, welcome. Yeah, go ahead, Dhananand Shivadkar.
Hello, ma'am. Nyanza, ma'am, you could go ahead. I guess you had a question. You raised your hand. Hello, am I audible?
Yes, Satyajit, you are. Okay, if anyone having any doubts, please speak. Then we'll discuss on that.
Okay. Yes, ma'am. You have a question?
Yeah, maybe mic issue.
Okay. You could also type in chat if there is a mic issue. Okay, okay. Anyone has any questions in regards to medical coding, career, certification, coaching, job?
Hello, Satyajit.
Yes, yes.
I'll have to leave because I have some other commitment. So thank you so
Oh,
much
sure,
for
ma'am.
sending me the link, and thank you for the information.
Thank you, ma'am.
Yeah,
Thank you so
thank
much
you
for
so
joining.
much. Bye.
Yeah. All right, guys, thank you so much for joining. I hope this session was we were able to deliver everything about medical coding and the career and every aspect. And yes, there are work from home opportunities as well, as there are companies like Access Healthcare and others which provide work from home opportunities. And these company, I believe Access Healthcare is in Pune, and it is one of the companies who provides complete work from home option. And there was one more question. So is India also doing medical coding? Well, not completely, but yes, with the help of Ayushman Bharat, they may plan in future to completely convert it into medical coding, just like US and other countries. But right now, we are working for US healthcare and countries like Australia, Dubai, as well as Saudi Arabia. These countries are implementing medical coding. All right.
Singapore
So
and Canada also.
yes. And guys, you could also visit our website, that is curecodes.com. I have mentioned the website in the chat itself. And you could also follow our page, that is our LinkedIn page, as well as our Instagram page and Facebook page. That is CureKodes.com. That is CureKodes. All right, over to you, Manideep, if you would like to add any points. Or Kiran.
Yes, sir, Sujit, thank you. Yes, yeah, it's a wonderful session. I understood most of the points. And students, if you want to join as soon as possible. So this is the discount price. And one more thing is, whatever we are giving training now, it is given by very sophisticated trainers, and we will provide 100% placement for you. And all the trainers they are working in the private means in organization. So whatever you need help, definitely related to any queries or anything post this training, everything, we will be support for you. Thank you guys. That's from my end. And if you have anything, you can use chat box or you can ask the queries. Thank you.
I want to add one more point here. The batch is going to start by December 10th. So please, if anyone interested, please ping me. Otherwise, yeah, please check with Satyajit if anyone interested.
Yeah, and we can go through that website link also, so you can find the other contact details so that you can contact and you can book your seats.
All right, everyone. Thank you so much for joining. Hope you will join our journey so we could make a better future for you as well. Thank you, everyone. Have a great day.
Thank you.
Have a nice weekend.
Bye.
Thank
Have a good day
you.
to
Thank you.
all.
Thank you. Thank you.
Bye-bye.
Thank you, everyone.
Thank you.